Okay.
Okay, we're live.
All right. Hi, everyone. Good evening. Good morning. Thank you for joining us wherever you are in the world today. My name is Lizelle Teng Lao, and I'm the Vice President of the Filipino Young Leaders Program, also known as FilPro, and the Project Director of Tayo, a virtual help desk for Filipinos during COVID-19. I'm excited to have this important conversation on disaggregated data and why Filipino Americans count. Before we start, just want to make sure if everybody can make sure they mute themselves so everyone can hear. And I'm going to be introducing you to everyone you'll be hearing from tonight. So in a little bit, we will have the 34th Attorney General of the state of California, first person of Filipino descent and second Asian American to occupy the position of California AG, the Honorable Rob Bonta. We also have fellow journalist and moderator for this evening, Agnes Constante, and our panelists, Dr. Melanie Sabado-Liwag, who is an assistant professor and director of the Master Public Health Program at California State University, Los Angeles, RJ Tugig, who is the director of research at the Bolason Center at UC Davis, and Zeni Cortez, who is a registered nurse and a member of the Council of Presidents of National Nurses United, the largest union and professional organization of registered nurses in the United States. We are so grateful to have you all here tonight for this important discussion. Before we begin, I'd like to acknowledge a couple of organizations and individuals and some upcoming events. FilPro, or the Filipino Young Leaders Program, is having two major events we'd love to invite you all to. The first is on October 20th, 2021 at 6 p.m. Pacific, 9 p.m. Eastern. It is the next episode in our Here, Here, Now series, which is called the Diamond Dialogue, a deeper understanding of the 75 years of U.S.-Philippine relations. Join FilPro as we discover and discuss Filipino American history and highlight the contributions, challenges, and impact of Filipinos in America. This event is being led by FilPro board member Lucky Siap. And on November 4th through the 6th, we will be having a global 3-day virtual national conference connecting Filipinos around the world called FilProCon. We'll have breakout sessions, workshops, and spaces for all of us to connect. This program is being led by FilPro alum Kit Furukawa and President Luala Cabalona. To find out more about sponsorships and partnership opportunities, please go to filprocon.com. We also have a lot of, as you can see, we have a lot of activities from FilPro. We are also celebrating our 9th anniversary this year on August 23rd to the 27th. This will be a 5-day virtual event with the goals of sharing our history as an organization, increasing awareness about our programs that serve the global diaspora, and spotlighting our alumni. We'll have more activities around that on filpro.org. And last but not least, this event would not be possible without our media partners who continue to shine a light and amplify stories about the Filipino American community. So just want to acknowledge a few that are here tonight. Christina Oriel, who is the managing editor at Asian Journal, the staff at NBC Asian America, USC Annenberg Center for Health Reporting, and last but certainly not least, our partners at GMA Pinoy TV, who is helping to produce this event with us tonight. Also want to acknowledge GMA Pinoy TV, first Vice President and Head of Operations, Sir Francis Francia, who's here tonight. GMA has some great important programming coming up. So here's a preview of their program.
There have been more than 3,000 documented cases of Asian hate incidents since the pandemic began.
Pinag-iingat po ng Philippine Embassy sa Amerika ang mga Pilipino roon. Kasunod po yan ang dumarami raw na mga kaso ng hate crime laban sa mga Asian Americans sa Estados Unidos.
We are stronger together. Let's be one in heart and choose to respect. Stop Asian hate. Ngayong Agosto, bigyang halagang makulay nating wika.
Balita sa Hilaga at Gitnang Luzon.
Yang ginpagwa na ang community quarantine classification sa mga lugar sa Western Visayas.
At ang pamanang iniwan ng ating mga bayani.
Muli pong nabuhay ang interes ng publiko sa mga nagawa ni dating Pangulong Noynoy Aquino at ng kanyang pamilya.
Handog ng GMA News TV ang mga natatanging palabas. One Mindanao, araw-araw na simula August 10.
Sa 8 anyos nga batang lalaki patay humanggi kulata kuno sa uyuan.
I Wonder Special, bayani sa makabagong panahon, August 29.
Ipaglalaban din ni Aguinaldo ang West Philippine Sea kung siya'y nabubuhay ngayon.
Pagpapahalaga sa wikang Filipino.
Tanong tuloy ng fans, senyales na ba ito ng collaboration?
At sa sakripisyo ng ating mga bayani.
Talaga nakaka-touch, sobrang nakaka-touch.
Buong buwan ng Agosto sa GMA News TV.
Mga Kapuso abroad, keep watching your favorite Kapuso stars and shows on GMA Pinoy TV. Not yet subscribed? Don't forget to visit gmapinoytv.com/subscribe to know more. Thank you to GMA and all our partners. And now I'm going to hand it over to Agnes, who is going to talk about the fantastic reporting she's done on our community and the impact that COVID-19 has had. Agnes?
Thank you, Lizelle, and thank you to everybody for tuning in today, whether you're wherever you are in the Philippines or here in the US. Thank you so much for taking the time to tune in today. So we're holding this event to wrap up a 6-month project that I worked on about the impact of COVID-19 on the Filipino American community. I wrote a total of 3 stories for this project with support from a data fellowship at USC Annenberg Center for Health Journalism. The stories were published in NBC Asian America, and so I just wanted to take some time to talk a little bit about some of the findings in the stories that I wrote. So the series was inspired by a story that I wrote last year about this issue, about the impact of COVID on Filipino Americans. This story, however, focused on those in healthcare, and that was because Filipino Americans have a high representation in healthcare, which increases their exposure to COVID-19 and in turn increases their risk of contracting the disease. So we'll put links to that story that I wrote last year and as well as to the stories that I wrote for this project in the chat. So if you're interested in reading those, you can have those links on hand. So the 3 stories that I wrote took a look at different areas when it comes to the impact of the pandemic on the Filipino American community. The first story looked at how nurses are looking ahead after what they've endured during the pandemic. The second examined the mental health impact of COVID-19 on the community. And then the final story looked at some of the factors that increase the community's risk of being affected by COVID-19, including health disparities. And it also looked at what leaders in the community are doing to address these disparities. With this series, what I wanted to do was just to contribute to existing coverage of how the pandemic has affected Filipino Americans by writing stories that I didn't really see in media. A lot of the coverage that we saw was really centered on Filipino American nurses, and I'm absolutely grateful for that because I think that was long overdue. There have always been a lot of Filipino Americans in healthcare, but I also wanted to learn about other ways that the pandemic has affected the community. So the areas that I was interested in is what ended up being the focus of these stories. So this is a little bit of an excerpt from the first story that I wrote. And for this first story, while nurses, again, did receive long overdue media attention, I decided to write something that was forward-looking to see what their experiences during the pandemic were and how they were moving forward. We know that Filipino registered nurses have experienced disproportionate COVID-19 deaths. The union National Nurses United has tracked registered nurse COVID-19 deaths across the country, and as of August 4, Filipinos account for 24.2% of those deaths. And for nurses of color, they account for almost half of those deaths. And that's really quite large. So we can see that Filipino nurses have been hit hard considering they account for 4% of registered nurses in the United States. So this is a photo of Zeni Triunfo Cortez, who is on our panel today, and we'll be hearing from her a little bit later. She's the president of National Nurses United and the California Nurses Association, and she was interviewed in this story, and she mentioned that it was a challenging year for Filipino American nurses, in part because a lot of them have pre-existing medical conditions that increase their risk of severe illness from COVID-19. She also mentioned that she knows some veteran Filipino American nurses who have said that they want to leave the profession because of what they experienced during the pandemic. Another highlight in this story, which is something I think that generally isn't mentioned very much, is that while Filipino nurses have been hit hard by the pandemic, for those that have made it through, some of them have said that they feel a sense of resiliency. This is a photo of Catherine Rubio. She's a registered nurse who lives in Los Angeles, and she was working two nursing jobs and decided to leave one of them shortly after the pandemic hit because she wanted to spend more time with her family. And she, shared that she had a really positive outlook during the pandemic, despite everything that she's experienced. Something that she mentioned is that nurses have found creative ways to cope with the stresses of the pandemic. Some of them made TikTok dance videos, some of them made their favorite desserts, and she herself took up hiking and spending time outdoors. So these are some of the experiences that I highlighted in this story that I don't think we necessarily hear too much about the positives. And these positive experiences don't negate the negative experiences people have, but I think it was just important to recognize that even with the heaviness that the pandemic has brought, there are also nurses who feel stronger after having gone through the past year. And that's something I sought to highlight in this story. So for the second story, I took a look at how the pandemic has affected Filipino American mental health. And I just want to mention that this story was really only made possible because of data that was collected by the UC Davis Willison Center for Filipino Studies. The research director of the center, RJ Tageg, is here on this panel today, and we'll be hearing from him a little bit later. But what that survey found, some of the findings that were in that survey is that more than half of those who responded to this survey said that they reported anxiety, depression, worrying, and other mental health symptoms. Of those respondents, at least 85% attributed those symptoms to the pandemic. Some of the reasons for those mental health concerns related to finances and losing jobs, but the biggest reason for these symptoms was the loss of social support because of physical distancing guidelines. So for this story, I collaborated with Filipino Young Leaders Program and also worked with the Center for Health Journalism at USC to hold focus groups with Filipino American students, parents, mental health professionals, and we found that for students, even before the pandemic, they were typically already dealing with depression and anxiety linked to cultural factors like differences in values between generations. So not being able to interact with their peers regularly during the pandemic was difficult because they didn't have that support system to help them through these stressors that they were already dealing with. This story also looked at the mental health impact on seniors. This is a photo of Jenny Samla. She's a mental health provider in Los Angeles. And she shared that she observed a rise in depression, in feelings of hopelessness in seniors. And this was also due to a lack of social support. The pandemic had forced areas of socialization for seniors to close down. So that includes places like churches and senior centers. And they were also unable to grieve normally over their friends who they lost during the pandemic because at certain points, during the last year, funerals were not allowed. So just in general, mental health professionals say that they saw a rise in Filipino Americans seeking mental health support during COVID-19, and that they hope that more community members will seek that support. For the final story of this series, I took a look at what's being done to address the health disparities and other factors that raise Filipino Americans' risk of COVID-19. This story focused on two main contributors. The first is the influence of the Philippines' colonial history on mindsets and practices that Filipino Americans carry to this day. One example of that is something called colonial debt, which is a tendency to tolerate, accept, or minimize experiences of injustice. So for example, somebody might be working at a hospital and not have proper PPE, and that puts them at higher risk of COVID-19, but they might think, at least I'm working in America. So that kind of mindset did have an impact on, on the increased risk of Filipino Americans in COVID-19. The second one was the lack of disaggregated data, which is what tonight's event is focused on. And this is something that other panelists will talk about a little bit more in depth later. But basically, the way that data is collected in the US lumps all Asian American subgroups into a single category. Something that I tried to see if I could find when I first started the series was how many COVID-19 deaths were Filipino American in California. But that data wasn't available because those deaths are counted as Asian American along with other Asian subgroups. So that's problematic for a lot of reasons. And one of the ways that researchers and people in the community are working to address this is by carrying out their own research to collect disaggregated data on Filipino Americans. And with that, I'm going to pass the virtual mic back over to Lizelle so we can dive into the panel discussion and talk a little bit more in depth about why disaggregated data is important.
Thank you, Agnes, and thank you for making sure, our voices are heard, especially during this time. It was really great to see a lot of those stories that we don't always often see. So thank you for continuing to report on that. So we're going to move into our next portion of our program. Let's talk about the importance of data, and more specifically, disaggregated data in the context of COVID-19. So for Melanie and then Agnes, if you can jump in on this, what is disaggregated data, and how is data in the US, and how is data being collected in the US, and how does that impact Filipino Americans?
Yeah, it's a really great question, and it's extremely complicated, more so because most people find it too intimidating to understand, but it's fairly simple. Data is just information, whether it's collected, self-reported, if it's passively reported or actively reported by people asking you directly a question, or if it's passively recorded in a way that is like a fatality record, like a death record, and found through various ways that can be ascertained both through the state or through the US Census, for instance, that has particular. However, one of the biggest things that we have to understand about data is that right now, the way that Filipinos are collected, because we are, when we talk about representativeness of the United States, we are a fairly small percentage. And so we are often clumped together or aggregated with other Asian subgroups. And so that's why we advocate for a disaggregation of this data. For example, Filipinos are clumped together with other Asians, and so that creates a large monolithic category, which many people in other disciplines have noted as this model minority myth, because we all have different socio-political backgrounds, different immigration stats, histories, various ways in which we experience health, and it's expressed. And so when we're clumped together as an Asian category, whether they're Filipino, mixed Filipino, one of the things that happens is that it homogenizes or waters down the experiences as the same. And so that's often what happens with this idea of disaggregation, and why we often want to advocate for the separation of data, specifically during COVID, more so because of these pre-existing conditions and disparities that actually existed before COVID and now have been highlighted and exacerbated because of the pandemic.
Thanks, Melanie. I wanted to chime in and just kind of give a journalist's perspective on the importance of disaggregated data. And I think a good example is this project that I completed, because when I first proposed it to USC, there was actually some concern that there may not be sufficient data for me to build a series on. The entire project relied on two data sets, the California Health Interview Survey and the Filipinx Count Survey from the UC Davis Lewison Center. So when I pitch stories to editors or to outlets, what really strengthens a story is if there are data points that I can cite to strengthen and support the focus of the story. I think a big part of the reason that Filipino American nurses received quite a bit of coverage during the pandemic is because there was data on the percentage of Filipino registered nurse deaths from National Nurses United, right? That figure has been cited quite a bit, where I think the highest number I've seen was that at some point during the pandemic, Filipinos had accounted for 30% of registered nurse deaths, again, despite the fact that they account for 4% of registered nurses across the country. And so just having those figures really makes a story strong. So if the California Health Interview Survey and the Filipinx Count Survey didn't exist, then this series wouldn't exist either, and we wouldn't be having this conversation. And then I also just want to highlight the second story, which again, I'd mentioned earlier, focused on mental health, because that story was built entirely on the data from the Filipinx Count Survey. In the community, and I think just in general, we know that mental health has suffered a lot for a lot of people during the pandemic. And for Filipinos, I could have built a story, just based on interviews with whoever I could talk to, but having a figure to cite and to be able to say that of respondents who reported mental health symptoms, at least 85% of them say that they were because of the pandemic. That just made the story a lot stronger and really helped illustrate the extent of the pandemic's impact on mental health.
Yeah, and I'm so glad you had mentioned that, Agnes, because we have a conundrum on our hands with Filipinos and Filipino data. We are often put against these ideas that there's no numbers, there's no problem. And if there's no problem, there's often no support, no funding, and no recognition in regards to that. The other second thing that we often is a barrier for research and getting data is the fact that we're often seen as a small sample size. Which is also a misconception, more so because we are definitely stronger in the west side of the US. However, we're extremely scattered around the United States in various areas where our patterns of immigration do not mimic what other subgroups of Asians have. We do fill the roles of agriculture and maritime industry, as well as healthcare, both legally and illegally. And one of these things that we don't talk about are those aspects of data that often go missing. The other aspect that is we don't often talk about, and I've had exposure through having access to various data points at a national level, is it's always nationally represented. So if we're in a nationally represented population, our numbers will never account to a comparable number compared to African American, Blacks, Latinos, or whites. So we always get clumped into an other category, which often never gets recognized. And so we are now in this revitalization of culture and language where Filipinx academics and advocates and stakeholders are really rising together, thank you to the pandemic, and providing us this space to do this, to really understand how we can work together to amplify that voice. So the data numbers that you do see, especially what you had received in earlier with the 30%, is actually at 32% of COVID-19 deaths of all the nurses that are accounted for, which does represent the 4% of national nurses in the United States. And the only reason why we have that data is because of the really amazing work that the Asian American Data Disaggregation Group here in LA, which is led by Dr. Nines Ponce and was done also by Dr. Lorraine Escobedo, to really look at the death data that is not public facing in California, but they had data access to because of the connections that we had through various stakeholders to provide that information to us. So we appreciate the advocacy as well.
Great. Thank you so much, Agnes and Melanie. This question is for RJ. One of the main data sets that Agnes used in her project was the Filipinx Count Survey conducted by the UC Davis Bulosan Center for Filipinx Studies. What were some of the major findings in that survey, and why were they important?
Thanks, Lizelle. Well, first and foremost, they're important because data on Filipinos is hardly existing, right? As Melanie had mentioned earlier, there's very few sources that you can really go to in order to find any information on us and our communities. And so we started the project with that in mind, this idea that, hey, there's really not a lot of folks looking, particularly from a quantitative perspective, on our communities, and even beyond that, from an ethnographics perspective, right? Recognizing the being Filipino mattered. And so we launched this project knowing that we had to really have good coverage, particularly with regards to both quantitative and qualitative data, because stories matter too. And one of the things some of the things that we really just found is with regards to mental health. I don't think that anyone is surprised in any way, shape, or form that we as a community are experiencing depression and anxiety levels that are, as Agnes cited earlier and in her article, to a tune of I think 81% for anxiety and 73% for depression. And these are at severe levels, were attributed to COVID-19, the experiences of folks during this first year of the pandemic. And I think that's also one of the things that is a strength of the surveys, that we were out there in the beginning. We had actually planned on creating a survey that was more broad and wasn't necessarily so specific on health, because we wanted to do the work on Filipino communities, but it ended up being a COVID-19 pandemic because the community partners that we've spoken to, especially when all of this stuff was happening, really needed to know what was going on within our communities, because everything was just going left and right and absolutely insane the first few months. And so I think it's really important to recognize that even just the existence of this data is hugely important. And particularly, I do want to again go back to those mental health findings, because mental health in particular is not something that is usually recognized within the Filipinx, Filipino American community, right? I mean, how, for example, can you ask for help as a student or as a mother or as a parent or as a child of someone? How can you ask for resources on mental health when your own families don't even recognize that mental health is an issue? Right, our Kwentuhans really spoke to that, and that folks that gave us their stories was really telling everyone about these feelings of anxiety and depression that they were experiencing, in part because we were connected with our families and separated from our communities. And family is a source of support, but can also be a source of pain, right? And I think it really was reflected in that data. And so I think it's really very amazing that we were able to get these stories across all of these different Filipino communities from all over the country, not just in California. I mean, I had some folks from like North Carolina, for example, in New York that gave us more information about what was going on with them. But let me just cut myself short and leave it at that. Ultimately, a lot of different issues regarding mental health, regarding community, regarding separation and isolation, and again, re-emphasizing that this is a really important lens that needs to be shown on our community.
Thank you so much, RJ, and thank you so much to Melanie and Agnes. All your work is just so important, and just making sure that we're just being counted and just getting our stories out there and just getting a lot of these topics that don't always get discussed. So thank you so much. Okay, so we're gonna move into the next portion of our program. I'm gonna hand it back to Agnes, who is gonna be doing the fireside chat with our AG Rob Bonta. Agnes.
Yeah, thanks, Lizelle, and thank you, Attorney General Bonta, for taking the time to join us for this conversation today. I know that before we dived into the questions, I think you had a couple of remarks that you wanted to say.
Yes, let me start with unmuting myself, and my dog Legolas wants to chime in as well. So you hear him in the background of Lord of the Rings fame, Legolas. Well, let me just say thank you for the opportunity to be here with you. I'm looking forward to our discussion, and it's an honor to join my fellow panelists here and everyone that's tuning in. I want to start by thanking the Filipino Young Leaders Program, Tayo Help, the USC Center of Health Journalism, Asian Journal, NBC Asian America, and the GMA Network. Just appreciate the convening, the dialogue, the bringing together of our community. And I want to thank you, Agnes, for the series that you wrote for NBC Asian America, illuminating the longstanding issues of health inequity within the Filipino American community, and also highlighting some of the larger questions that our nation still needs to grapple with. And when it comes to data disaggregation, I think our work has never been more vital. COVID-19 has laid bare for everyone to see that socioeconomic and health disparities have real everyday consequences, and we need to know those disparities in order to address them. And disaggregating data is something I fought for in my prior role as a California State Assembly member for a long time. And now as California's Attorney General, it's a priority I carry with me as I lead the largest state Department of Justice in the country. And it's a priority because of who I am. I'm a proud member of the Filipino American community. I was the first Filipino American to serve in the California legislature and now have the honor of being California's first Filipino American Attorney General. And I know firsthand that socioeconomic disparities across many communities are real. And these inequities often go overlooked because they aren't captured in the data. And that's why conversations like this are so important. And but when you disaggregate data, you make visible what was once invisible, and you reveal what was previously concealed. And I know a lot of people, when I've talked about disaggregated data, have been very intensely opposed. They talked a lot about affirmative action and quotas, even though quotas are unconstitutional and illegal. And my response was always, this is data. And this is information. What we do with it will be a separate discussion, but we always talk about evidence-based solutions, data-driven actions. And in order to have those types of solutions, those actions, you need to have the data in the first place. So, and finally, before we dive into the questions, I just want to say that I see the job of Attorney General as being the people's attorney, to fight for everyday folks, especially those who have been hurt and harmed or abused or neglected, who haven't been seen, who haven't been valued, and to even the scales of justice for them, to be their champion and to fight, to right historic wrongs, fight injustice, and lift people up. And when you boil it down, data disaggregation has a really important role in helping to fulfill that mission, ensuring our policymakers and elected leaders have the tools, have the data to promote and secure justice for everyone, including those who are often overlooked. So looking forward to our fireside chat to discuss this and more. And thank you again for having me this evening.
Great, thank you so much. Yeah, and so the first question, I mean, you kind of talked about, right, you've been a longtime advocate for disaggregated data. You also pushed for bills in the California Assembly while you were there requiring the collection of disaggregated data. Can you talk a little bit more about what were some of the ways that you advocated for this type of data collection while you were in the Assembly?
Yeah, when I was in a state legislator, I had the honor of being the author of the AHEAD Act, AB 1726, back in 2016, which in its original form required the collection of disaggregated data in our higher educational institutions in California, CSUs, UC, our community colleges, as well as in our health and public health agencies. And to me, it was common sense. When I was in college, we had a monolithic Asian American data collection set for incoming students. And I had asked with some of my fellow Filipino American students that we have some specification beyond that of different groups, including Filipino Americans. And so this is something that has made sense to me, was common sense to me, was just good policy and a good way to collect data for a long time. And having the ability to advocate for similar data collection statewide made perfect sense for me. It was very highly politicized as a battle. We had a lot of incredible advocates and activists from across the state working hard in support of the bill, but it was also something where we had a lot of outspoken, intensely feeling and motivated opponents to the bill as well, who I think feared more what it would lead to than maybe the data collection itself. But it was very a very pitched battle, and we were able to get the bill signed into law. It applied to a smaller universe than it originally intended to, but some of the higher educational institutions voluntarily decided to collect disaggregated data on their own. So that was a success as well. And then, as I mentioned about COVID-19, and as we all saw, the disparities in our pre-existing disparities were just laid bare for us all to see. And we saw and experienced firsthand, painful as it was, that our most vulnerable communities were hurt first and hurt worst. And we, through data, were able to uncover things maybe that we didn't expect to see, like that the Native Hawaiian and Pacific Islander community were very damaged by COVID and in need of support, facing disparate impacts. And I worked with a group in Alameda County that looked at racial disparities in our county, and part of my job was to help uplift ideas for statewide application, and that led to my authoring AB 1358, which is now being carried, since I'm now Attorney General and I've left the Assembly, it's being carried by my recently former colleague, Assemblymember Al Morisucci, to expand the categories of data collection throughout our healthcare system even more. So we're uplifting the idea of data disaggregation through our legislation. We're making progress. We're still not where we need to be, but I think the more we talk about it, the more we see its value, the more we understand the disparate impacts, the more we can take steps to address those impacts and promote more equity.
Right. And can you talk about why disaggregated data, and also some of the bills that you've authored, like 1726, and if I remember correctly, it was 1530, was it 1536, the other one that you authored? Why are those important? Yeah, so why are they important to you, and also, to the Filipino American community?
A couple of reasons. For me, the Filipino American community is one of the communities. It's certainly not the only one, but one of the communities that is sometimes rendered invisible by aggregated data. When we treat all Asian Americans as one monolithic group and don't tease out the different experiences of the different communities within the Asian American community, we're not able to see those unique experiences, outcomes, and we're not able to consider policy proposals and interventions that can help address some of those disparate impacts. And so the Filipino American community has been one that has often been the community that's been concealed in aggregated data, or rendered invisible in aggregated data. And we're able to understand the Filipino American community with more dimension and nuance by disaggregating that data. And sort of that commitment to make the Filipino American community more visible is something that's been with me for a long time. As I grew up in elementary school, middle school, high school, even college as a history major, I cracked open history books and never saw in those books the stories that I knew to be true. Stories I knew to be true about the Filipino American experience in California, and with some of the greatest social justice movements in the history of our state and our nation. I knew about them because my parents lived through parts of them and shared with me all of them. The stories of the Agricultural Workers Organizing Committee and Larry Itliong, and the Delano Grape Strike of 1965, literally starting the farm worker movement, and reaching out to Cesar Chavez with the National Farm Workers Association and asking for collaboration and partnership, and Cesar Chavez 8 days later saying yes, and then them together creating the now iconic, historic United Farm Workers of America, that collaboration of working together. But I didn't read about Larry Itliong in the history books. I didn't read about the Delano Grape Strike of 1965 or AWOC. And it was invisible, and I wanted to make it visible. So that's what I wrote about for my senior essay in college, a story that had been rendered invisible that I wanted to give visibility and give voice to, provide voice where there was silence. That was the Exeter event where of 1929, where Filipino Americans were attacked by some of the white farming community families. And so that ongoing quest to make the Filipino American community more seen and valued, and for things that they've done but just weren't being talked about, is part of an ongoing effort of mine. And as the first Filipino American state legislator in the history of California, the first Filipino American attorney general, I see it as my responsibility to uplift our community and make sure that we're being treated fairly, that we're seen appropriately and valued as we should be. So it's personal to me, and I've seen my parents, who are social justice activists to the core, fight for other communities to be seen and be valued, whether it was my dad marching in Selma, organizing for voting rights and civil rights and being in church with Martin Luther King Jr., or both my parents working for the United Farm Workers of America. Our family of 5 living in La Paz in a trailer, a stone's throw away from the home of Cesar Chavez. My dad working in the front office with Cesar Chavez, and my mom fighting for the restoration of democracy in the Philippines after the declaration of martial law by Ferdinand Marcos. That ongoing quest to have communities that are overlooked, not being seen, be valued, is disaggregated data is part of that same mission, to pull out and tease out and show and uplift and illuminate and highlight the experiences of specific communities that when they're being hidden.
Great. So as a legislator, you helped author bills, to help disaggregate data. But now that you are California's Attorney General and in the executive branch of government, can you talk about how in this role you are going to continue working toward the collection of disaggregated data, and also if there are any specific initiatives that people should know about right now, and also if there are ways that Filipino Americans can support these efforts?
Well, we certainly have an effort in the legislature that Filipino Americans can rally behind and in support of the AB 1358, authored by Assemblymember Morisuchi, which I originally authored before I became Attorney General and was appointed by the governor. So that's ongoing. And then, we can also seek to expand in any place where disaggregated data is not being collected, that collection of data. There's statewide collection for sure, but there's also counties, cities, in private college institutions as well. So just as a general matter, it's important to always kind of ask ourselves as we collect data, and data powers action and policy and decisions, is that data disaggregated? And it's an appropriate question to ask, and it's always I think appropriate to consider pushing for disaggregated data where it's not being disaggregated. In my own Department of Justice, I'm about 100 days in the job, just a little bit more than that. And I've moved now from the legislature, where I had sort of a blank palette to work with, where almost any law that I thought was unfair or unjust or archaic or had unintended consequences, I can push to have abolished, and any new law that I thought would help promote more opportunity, justice, equity, and inclusion, I could author. And so that's the role of a legislator. And now in the executive department, I am implementing the existing laws and making sure that I'm enforcing those laws. So where there are requirements to collect disaggregated data, I can help enforce that, make sure that it's happening according to the law. But in my own Department of Justice, I've already asked my team to review all the data that we collect, and we collect a lot of data with respect to criminal justice and other types of important data. We have reports on hate crimes, for example, and other information, and to make sure that we are collecting disaggregated data wherever possible. So that's not something that we're going to be able to do overnight, but it is something that I've shared as a priority for me. We need to lead by example. And so as someone has the honor and privilege of being in charge of the largest state Department of Justice in the nation, and the second largest Department of Justice in the nation, just second only to the U.S. Department of Justice, I want to lead by example and have us start collecting disaggregated data every time we can. So those are some of my thoughts on that question. But I think just to start, or to end where I started, it's important to always think about, so many entities and institutions collect data, and probably a very the vast majority do not disaggregate and have aggregated data. So this should be an ongoing mission of ours to continue to push for disaggregated data wherever possible.
Great, thank you so much, Attorney General. That was my last question. So I really appreciate you just taking the time to be here for this discussion. And thank you for all the work you're doing as well. And I'm gonna pass it back over to Lizelle.
Thank you again. Thank you, AG Bonta. Before you leave, because we're Filipino, we want to get a quick photo op with you. So if we can make sure all the panelists' cameras are on first, we'll do that. And then we can get a photo op for everyone after we take that photo. So.
Okay, I'll just count.
Yep.
Okay, for the camera, 3, 2, 1, and then one more.
Okay.
3, okay, 3, 2, 1. Okay, got it.
Is that it? Okay, great. Okay, thank you so much.
Thank you. Appreciate all your leadership. Look forward to working with you. Always
you.
reach out if you need anything.
Thank you.
Okay, so we're going to move into the next portion of our program, our next panel. And this is with Zenny. And yeah, so let's see, get my notes. So this question is for Zenny. So the National Nurses United has been tracking registered nurse deaths throughout the pandemic and found that while Filipino Americans account for 4% of RNs, they've accounted for between 25 and 30% of RN deaths. How has this disaggregated data been helpful to the community, and how might things be different if this data didn't exist?
Well, hi everyone, and thank you for having me on this panel. As we have seen during the pandemic, there are big differences in health outcomes depending on your race. My union, National Nurses United, has been tracking the deaths of registered nurses since the beginning of the pandemic. More than 400 registered nurses have died of COVID, and we know this is likely an undercount. We noted the disproportionate impact of COVID on nurses of color in a report called Sins of Omission, which we updated in March of this year. So if I can have Agnes or Lizelle, if you can put the link to the report in the chat, that would be great. Thank you. In the report, we said that the majority of registered nurses who died of COVID and related complications were nurses of color. Filipinos are just 4% of registered nurses in this country, but we are nearly a quarter of the nurses who have died of COVID in the United States. And if you just look at the deaths of US nurses of color, Filipinos make up nearly half of nurses of color who died of COVID. If we had not collected and broken out this information about Filipino nurse deaths, I honestly don't think anyone would have. This inequity would have been buried or even overlooked. Having this data about Filipino nurses helped to start a national conversation about the sacrifices of Filipino registered nurses and other Filipino healthcare workers whose contributions have been overlooked and ignored. News stories began covering the disproportionate impact of COVID on Filipino nurses and telling their stories. What's so heartbreaking about their deaths is that they would still be alive today if they had received the personal protective equipment they needed to do their job safely, or if their hospitals have been following proper infection control procedures and provided enough staff to safely care for patients. I want to put a face to some of these numbers. This is Celia Yap Banago, a registered nurse for nearly 40 years at Research Medical Center in Kansas City, Missouri. She had expressed concern about inadequate PPE at her hospital. She died of COVID in April last year, a week before what would have been her 40th anniversary working at the hospital. She was 69 years old and she left behind her husband and 2 sons. This is Janine Paste Ponder, a registered nurse, a wife, and a mother of 2 daughters and the daughter of a nurse. She worked in the medical surgical unit at Altabate Summit Medical Center in Oakland, California. In her unit, nurses were only allowed to wear N95 respirators in patient rooms. She was wearing a surgical mask in the hallway when a positive patient left their room, and she ran after them so they would not infect others. Janine got COVID and died in July last year. She was only 59 years old. Nurses fought back and demanded PPE, and today at Research Medical Center, The nurses have the PPE to do their jobs safely. Janine's death sparked an investigation, and earlier this year, California's Occupational Health and Safety Administration fined Sutter Health more than $150,000 and cited them for 8 serious COVID-related workplace safety violations. Without disaggregated data, more Filipino lives would be at risk. This is why data collection is so important. Unfortunately, most of our government agencies are not holding the healthcare industry accountable and requiring it to publicly track and report COVID data. But without public data, we cannot monitor the impact of COVID or make changes to public health planning or policies. Nurses know that we need detailed, consistent data to understand how and where the virus is spreading, who is most vulnerable to infection, and whether interventions are effective. We must fight for this knowledge so that these nurses and other healthcare workers' deaths will not have been in vain, and we can prevent future tragedies. So thank you.
Thank you so much for continuing to fight for our frontline kababayans during this very challenging time for all of us. And will definitely, their contributions will not hopefully go in vain. So the next question is for Melanie and RJ. What are ways that Filipino Americans can help close the gap in data in the community? And what are some surveys that are currently underway that community members can currently participate in?
So thank you, Zenny, for sharing such wonderful and uplifting stories. And I think it hits home for many of us who have family members who are in the healthcare industry and are impacted both physically and mentally by this pandemic. So thank you for sharing. I think one of the biggest things to bring to light regarding how the community can help is to step back and understand what questions are being asked and how to better ask better questions. I think one of the biggest things that we're seeing oftentimes with this data is by registered nurses, right? This is based on a group that has a very strong solidarity to it, that has a good sense of membership and providing, a snowball effect of information that gets filtered, hence why, information is obtained. But one of the things that is a fault of our community, which we hope to break, is that we are often not participating in these types of activities. If you see in the data that is existing among Asian and Pacific Islanders, is that we are less likely to participate in our own active health. And that then exacerbates into all the other different types of participation, whether it's in clinical trials, donating biospecimen, and participating in studies such as a survey or an interview, or even a kwentuhan with somebody who just wants to collect information regarding experiences. A lot of people are very hesitant to want to be captured in a bad light, and we understand the distrust that might exist in the community beforehand. But with the new, again, revitalization, we want to provide people safe spaces so that our voices collectively can be ascertained, whether it's our histories, our families' histories, and our current situations. We need to obtain that so that it can be published and it can be utilized by journalists like Agnes and Lizelle to amplify in larger spaces in which many of us who I'm an academic do not occupy. And so those are things where we need to collaborate and to find interdisciplinarity where we often didn't have that before. Being siloed in our own sectors is really not helping. And so I think, again, COVID has provided us, this grim look of how our community has been affected, but it has allowed us who are still standing to do something about it. And I can go on a little bit more, but I wanted RJ to talk his piece too as well.
Thank you. I do want to add to what you mentioned with regards to the distrust, because I think there has to be a recognition that data collection, research, academia, all of that is inherently, a system that supports white supremacy, right? And the ways in which researchers in the past have collected data have been damaging to our communities, particularly through these patterns of what is reported on us, right? In aggregating data to begin with is violent to us and our communities. And so there is the use of data that has been done in the past on our communities that have been just things that we inherently do not see our own experiences being reflected upon, right? And so what I want to say though is that there is a growing body of folks, Melanie, myself, a lot of ethnic studies scholars, a lot of public health scholars who are Filipino, Filipinx, who are championing the causes of getting our own data, right? So that we break away from those models of the ways in which data has been used in the past. And I will say that it's starting in the academia route with folks like the Phil Child Network, but the equitable data collection is actually being done by folks in community organizations like National Nurses United, California Nurses Association, like PhilPro, like Migrante, for example. These are community organizations that do data collection in their own way. But it's all in different ways too, right? So part of it is that, if you know of an organization out there, they're probably collecting data, right? So go help them out, right? And I think that's one of the things that I just want to really highlight is that community organizations, particularly in the Filipino community, have been doing this work and have been doing equitable work towards justice. And academia is catching up. And so that's all I wanted to say. Just this idea that it's not as if data collection doesn't exist. It's just that data collection has been historically not something that we've been part of, and now that we are growing into it, so go participate.
Yeah, and just to add to that, RJ, I'm so glad you had mentioned is we are catching up, and we're not. Don't look at academia or these people at high positions as the leaders. Like, we need to advocate that we're here as partners and we're here to collaborate. So we, for instance, work with the community-based organizations. We want to work with multi-sectors so that we can solve the problems from multifaceted ways and not just this one direction that often has been ingrained in us in white spaces. And I think that's where we need to kind of experience and understand how much power we actually have by collaborating. And so with that aspect, we do want to collect information. So RJ collected Filipino count on the beginning of COVID, and the Field Project follows suit of that. And so I'm leading a group of people in collaboration with the Bulusan Center and amazing folks throughout California and the nation to support more information on the experiences of COVID. We know you're tired. We know that there's a lot going on. I'm sure that, even wanting to be in this digital space is also very difficult, but we appreciate your time and we want to be able to compensate you directly in many different ways. And so that also comes with, asking for more funding and putting our stakeholders and our political figures on direct access so that they kept accountable to their words. And so I'm glad that AG Bonta was here, because we want to make sure that if he's on our side. And so how do we make sure that he does exactly what he says he does? And so that's what we should do, is keep each other accountable for the actions in which we speak and what we hope to represent for the community. And so there's a lot that we can talk about, and I know that we're running out of time, but I'm happy to share my information, and thank you, Agnes, for putting up the Field Project, and people can participate in ways that they feel, and they can contact us about how to better participate in all the different activities that we're doing.
Thank you so much, RJ and Melanie. We do have a couple of questions that were dropped earlier in the chat. So we probably have time for one or two. So this one looks like it's directed towards RJ. Could you talk about more about how legal status is captured qualitatively and quantitatively in the Philippine X survey, if at all? And was it easier or harder to get Filipinos to open up about their legal status by having data collected through Zoom or virtually?
Yeah, I mean, unfortunately, I will say that it's incredibly hard to keep track of that information. The ways in which traditional researchers have done so is by doing kind of like asking around the topic, right, rather than asking directly. Because if you ask someone about their legal status directly, more likely than not, they're not going to tell you the truth, or they're not going to answer your question. And so I will say that I tried with the Filipino Account survey by asking things that would kind of lead us to whether or not someone has you know, a legal status in the United States. But I will say that my my sample size is just way too small to make any strong correlations or any really useful information out of it. I will say though that with regards to the kwentuhans, I have had folks who are undocumented also participating in the kwentuhans. And I think that space has been really conducive to really having those deep conversations, because it is a space in which they feel like they can talk about it, right? And this is why we really need also, in addition to the quantitative work, the qualitative work to follow suit or even lead the way. I will say also that, you know, my own identity as an undocumented person of color here in the United States probably helps with folks feeling comfortable in sharing their own legal status over the course of a conversation. But for the most part, it is a really hard thing to take a look at. And we may have some folks, you know, sharing their stories, and we'll see how that pans out across the work that we do.
Yeah, I wanted to add to that because academically, it's very hard to get that through human subjects ethics. And the reason for that is because we want to make sure that these people are protected and that they feel comfortable answering the question if it is asked. And so it does go through like a very rigorous standard to make sure that those people are protected from, you know, other entities. And so there's a lot of firewalls and a lot of data type of nuances that need to be created if you're going to be asking that information and making some type of news from it. So yes, it is definitely very difficult, both on the logistical side, but also having people come forward to basically admit it.
Thank you. I'll ask this one last question, probably for Melanie. I think you've already touched upon this, but what can Filipino Americans do on their own to be able to solve this concern on disaggregated data?
Yeah, just to kind of add on, and I'm sure RJ has other thoughts in regards to like what more we can do. But I think that AG Bonta actually hit it very much on the nail when he had said that there are places that are not even collecting information on Filipinos, or even asking to, you know, whether or not there's a Filipino checkbox. Literally, you know, there's ways that we can change that, and the dynamics of how even patient care has changed is also different, and that has changed over time. So I think one of the things is to make sure that, you know, paying attention to how your data is actually being collected and ask questions in regards to if the data is going to be publicly available and how to access it. And so it all comes into this conversation of, I'm providing you information, now be transparent in regards to, you know, where is that, how is that information going to be utilized to benefit me or benefit the community in one shape or form. So I think that's another addition to, you know, not only working with the communities and understanding the various types of data and how that's collected, but also, you know, participating in areas that we often are not participating because we have no time, we have other things going on in our lives, but we have to make time, especially if we want to be visible in the community. And that's a really, really big factor that I see rising up from the new phases of the generation coming.
If I can add to that, In addition to the community participating and keeping track of all of this stuff, I think the onus is actually on the researchers to make these things accessible to the community members themselves, right? Because like Melanie said, people ain't got time, people ain't got attention to devote to this stuff. And, you know, especially when it comes to social science research, a lot of times the results of which are very inaccessible in one way, shape, or form for one reason or another to the folks who are providing that data. And so I also think that researchers should go out of their way to make sure the community, Filipino communities are hearing this information. And yeah.
So
Well said.
ultimately, I think ultimately we just have a lot to unpack. I think Filipinos and Filipino Americans, regardless if you're here in America or around the world, there's just so much that people do not know about us, about our culture, about our socio-political histories. And I think that we need to unpack that. And the only best way to do that is to come from our voices. So yeah. Go back to Lizelle.
Well said. Agnes, any closing thoughts?
Yeah, I mean, I think I just wanted to thank everyone who is here today, to all our panelists and everyone who took the time to sit here through this discussion. I know we're a little bit running over time, but I think it was a very important discussion. So I just wanted to say thank you to everybody for taking time to be at this event. Yes, it is Filipino time. We're running a little bit late. So I just really appreciate it. And yeah, I'll hand it back to you, Lizelle.
Okay, yep. And because we're Filipino, we'll try this again. If you feel comfortable, if you could turn on your cameras, we'd like to do a quick group photo.
For everyone in the Zoom.
For everyone in the Zoom. And then Jared, just tell us when.
Okay, I'll just wait for everyone to turn on their cameras. Okay, I guess everyone's camera is on. Okay, 3, 2, 1. Oops, okay. Another one, sorry. 3, 2, 1. And then last one. 3, 2, 1. Thank you so much.
Thank you.
Thank you, everyone. Thank you to all our panelists, our media partners. Thank you for what I hope was an enlightening conversation on data and what we can do together to make sure we count and are getting our stories out there. So thank you again.
Thank you. Thank you, everyone.